Good evening, good afternoon, and good morning. This is the 2114th, 13th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Prakash Rao. Let us begin the session with 1 minute silent prayer. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. And the purpose of the forum is to take homeopathy to every home around the world. We have so far uploaded more than 3,800 videos at YouTube. You can search it at IFPH Homeopathy at YouTube. Let me come to today's guest. And as you all know, today our guest is Dr. Prakash Rao. Sir has completed BA, PG in rehabilitation, and MD in homeopathy, PhD in homeopathy, and is a retired research officer, CCRH, Government of India. Has more than 30 years of clinical experience, that is research experience at CCRH, and so has undertook many projects with the UNICEF and AIDS Control Society, as well as one of the leading personality in the research of projects as far as homeopathy is concerned. He has presented so many, the maximum number, I must say, maximum number of research papers in this forum, and is the person everyone is looking to, because homeopathy is at a juncture where people used to say it is an unscientific one, it is a pseudoscience, but the kind of research work conducted under the leadership of Dr. Prakash Rao has shown that homeopathy is not a pseudoscience, but it is the purest science among sciences. So, today, the sir has presented a beautiful session on fever research and homeopathy. And today we will have the second part of the same, that is management of active and chronic fevers. So we proudly welcome the guest of the day, Dr. Prakash Rao, to the stage. So we welcome, sir. You can unmute yourself and you can share the screen and everything. You are co-host now. Please unmute, sir. You are muted. Yes. Please,
Sir, can you see now, sir?
sir, please open the. It is not yet open, sir. It is stuck
Okay.
somewhere in the front page.
No, yes, sir.
If you find it difficult, you can close it and then open it.
Now, sir, it is coming. Now it is open.
It is not yet open, sir. Yes, it is. It is here. Fine.
Yes, sir.
Acute fever and homeopathic management.
Yes, sir.
Yes. Fine,
Thank you.
fine.
My daughter helped me, sir. Okay, sir.
Yes, yes.
Sir, just this is only reminder. I have wasted around 5 minutes of time. Just a reminder of the old things. Thank you, Dr. Dhanesh, sir. Thank you for attending. Sarji, Paswan Sarji, Namaskar. Now let us start the session, sir. See, definition of acute temporary elevation of the body temperature about 38 degrees centigrade temperature or 100.4 degree Fahrenheit is known as acute fever, and it is a fever sensation. Fever is a physiological defense mechanism which used to be felt as a very good immunomodulation mechanism, but some of the fevers will leads to complications. Therefore, the fever has to be treated properly. And classification of acute fevers. This is hyperacute, acute, subacute, and chronic. Few hours, that is hyperacute heat stroke, meningococcal septicemia, and acute means less than 14 days, influenza, malaria, dengue, they are all acute fevers. Subacute means 2 to 6 weeks, typhoid, infective endocarditis, and the result will be that side at this side 50% if the proper treatment is not taken. If proper treatment is taken, all the fevers are will be under control. The chronic fevers are more than 6 weeks duration. They are the tuberculosis, autoimmune disorders, as well as fevers due to malignancies. They never subside, and we have to keep in our mind. So this is the acute fever and duration. What are the causes? Infection, viral infections, bacterial infections, fungal infection, protozoal infection, parasitic infection. These all will cause fevers. Now, what are the examples of these causes? See, infection means influenza, COVID-19, COVID-19, dengue, malaria, typhoid, pneumonia, and usually misdiagnosed is urinary tract infection, particularly in females. Then non-infectious disorders are autoimmune disorders, drug fevers. So most of the allopathic medicines, particularly the painkiller, non-paracetamol painkiller, and some of the corticosteroids, when they were taken for controlling some autoimmune mechanism, they will produce mild temperature. Then malignancy, always there will be a low grade temperature. Then heat stroke. Vaccination also produces one of the complications, and what you call the side effects of the vaccination is fever and tissue injury. There will be cellulitis in the body. There will be infection because of scratching. There will be injury unknown to the foot. There will be diabetic neuropathy, where there will be a mild ulcer will be present, and it will be unnoticed by the patient, and that also produces 1 degree of the temperature, which will be unnoticed, and patient all normal functions and sensations will be carried out. Why the doctors are not in a position to diagnose the fevers means one is autoimmune disease, second is malignancies. So these two are very difficult to diagnose. Here, what I want to tell to homeopathic doctors, the experienced homeopathic doctors, is that most of the homeopathic doctors will feel that they are inferior to allopathy. It is not like that. Most of the allopathic doctors, despite of their excellent college education which they boast, and the supportive lab investigations, and all corporate attitudes, they will miss so much of diagnosis that most of the patients will reach to a corporate hospital, a super specialty hospital, from a rural physician, from a homeopathic doctor, from an Ayurveda doctor, from eye systems of medicines, and the corporate hospitals will boom and run, because where the surgical stage will come, where a homeopathic doctor, because of his excellent experience, he will understand the disease and limitations of the homeopathic treatment according to the aphorism 70 of Hahnemann disease classification, and he will refer the cases to allopathic hospitals, where the allopathic hospitals are doing well. When the cases is not treated properly according to his guidance, if the diagnosis is missed, and if something happens, the same case will come to a homeopathic doctor for further treatment, and where the homeopathic doctors will deal with all cancers, all the cases that are very, very serious, because everybody will say that he is going to die, even in acute temperatures, and when septicemia develops, even in cases of fever also, patients will come to homeopathic doctor as a last resort, and where the homeopathic doctor, if he sees such type of 10 cases, he will be in a position to cure one case, and he will be in a position to manage around 8 cases, and one case which requires definitely hospitalization and nursing care and ICU support may cease. And this is the status of homeopathic history in such a beautiful treatment attitude, aptitude, and the knowledge of the homeopathic doctor will be always uh, for go for criticism, because the success is being understood and the competition is being understood. When they criticize, that criticism we have to take healthily. We need not initiate, we need not make him popular by criticizing him more and more and more and more, because The scientists, even ICMR is not carrying out wonderful research work where to tell that homeopathy is a placebo effect. When the ICMR is not in a position to brush the system as a placebo, what and one individual can do who never carries out his own clinical research, his own clinic. So when see to tell that it is not effective, to tell that it effective, it needs research. So without doing research, using one's social status or media together, like it is nothing like to get a cheap popularity, and by that the system never fails, or the system because of one's opinion. One person must know that he has to tell that it is placebo effect means he has to do double blind methodology investigation on particular cases, or he has to take up pharmacogenetics and pharmacology. He has to give homeopathic medicine to the rats or the animals or monkeys. Then he has to produce the disease. If the homeopathic medicine is not in a position to cure that particular disease, then he has to tell that it is placebo effective. Again and again, I am telling the placebo effective means the efficacy should be lesser than 30%. If the efficacy of the medicine is lesser than 30%, it will be known as placebo effect. Placebo effect does not mean that homeopathy is placebo. Placebo effect biostatistically is known as lesser than 30% of efficacy. We have chosen similia similibus curanter. A similia similibus curanter will be always lesser than placebo effective. Any critics, any scientist, he will understand if he knows the biostatistics thoroughly. Anybody who is speaking on media, either YouTube or what you call or WhatsApp or any other media, Instagram or something, Facebook, he has to come across the table and he has to discuss with scientists like us. Then he will keep quiet, going there and discussing like what happens in political news or analysis. That is not the science. And as a scientist, one must understand what is science, how to criticize science. This is unfortunate. The lesser knowledge people, they do not know that they are criticizing without any proof. Even the Lancet people also, they have carried out various cross studies on osteoarthritis. With that osteoarthritis, they told that homeopathic effective is placebo effect. They never told that homeopathy efficacy is not present, but it is lesser than placebo. Lesser than placebo because the similia is similibus curanter. The same similibus curanter rule is also applied to isopathic system of medicine, that is vaccination, where the maximum percentage of success of vaccination, only polio, that is 92% success. Rest of all the vaccinations are above 60%. Therefore, they write articles such as beyond p-value. Beyond p-value means the p-value will not be applicable for some of the cases. Particularly, the evidence-based medicine never covers. One do not know, the person who is criticizing, he do not know that cirrhosis of liver is not an evidence-based medicine. The liver transplantation is not an evidence-based medicine. These the things the ethical committees will issues. One has to go through the ethical committee of WHO that has been supplied and ICMR. The kidney transplantation never covers evidence-based medicine. Nobody knows this. Only dialysis will give evidence-based medicine control. The kidney transplantation, removal of abscess, cirrhosis of liver, cancer of the liver, they never come under evidence-based medicine because each patient will differ for them. If they treat 10 cases or if they perform the surgery for liver transplantation, only 5 patients will survive, 5 patients will die. And one has to know that this is most unfortunate, the most dullers, most persons who never read the textbooks and whoever are not up to the mark in the research only will criticize the others. See, so far in the total world, the kidney transplanted person, if you go through Davidson textbook of 22nd edition of the Davidson textbook of medicine, the long surviving person of after kidney transplantation is 20 years, and he is the patient who is present in Australia. In India, 5 to 10 years is the maximum time after transplantation. Below 5 years, 50% of the patients are dying, and the ethical committees never call the evidence-based medicine for transplants except cataract and eye disorders. Rest of all the transplanters are not evidence-based medicine, and evidence-based medicine never covers. And this most of them do not know, and they will be going on telling that blah 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 and talk something which is unscientific. They know that they are using their influence, their position, and their approachability towards media, but they are not approaching the science. So come to our subject, because as a homeopathic doctor, I am forced to speak wherever I go. Let anybody come across the table and sit around the table and discuss. We will show the papers that have been published. We will give the evidence from the institutes like JIPMER, where the research has been carried out, where the papers have been published, where the allopathic research is being converted, how it has been accepted and integrated medicine. So this is about the criticism. Now come to pathophysiology. Just I am making brushing up. Infection, immune cells activated, IL interleukin 1, interleukin 6, TNF alpha, and cyclooxygenase activation, prostaglandin temptation, hypothalamic set point, chills, shivering, vasoconstriction, body temperature rises, immune response enhanced. This is the pathology of the fever. So we have wonderful medicines according to pathways what the pathology that has been produced to contradict this pathology. The similia similibus currenter medicines are also highly effective. Because of the similia similibus currenter, because we have certain principles, you are going on a tract which has been laid down by train tract. See, you cannot run a bus or aeroplane on train tract. In the same fashion, see, a fish can't climb the tree. So when they come to us and they say that, see, we can't go very fast like us, and your system is not scientific. No, train is also having very fast. We have Vande Bharat. Now we are going for bullet trains, very fast, more faster than the jet and aeroplanes. That is going to come. The person should have a scientific attitude to accept. Even a person who won't accept only will criticize others. So, clinical features, general symptoms, fevers, chills, rigors, sweating, malaise, weakness, headache, muscle pain, loss of appetite. These all you know very well. Associated symptoms like upper respiratory tract infection, cough, sore throat, dysuria, there will be burning urination, there will be vomiting sensation, there will be diarrhea, there will be rash and abdominal pain in some of the cases where typhoid or some of the parasitic infections are present. And drugs, danger signs, immediate what we have to do, immediate referral is required if fever is associated with altered consciousness, neck stiffness, which will be produced in meningitis, persistent vomiting convulsions, breathlessness, chest pain, severe dehydration, hypotension, oxygen saturation below 94, and fever lasting for more than 7 days, and infants less than 3 months with fever and suspected sepsis. So these are the some of the acute case, because fever is an acute fever. Fever is an acute one. Everybody will be anxious and the patient will be bedridden. Patient can't perform his work. Despite of fever, some of the patients will go to their routine work. There the infection will increase and he will be bedridden. A homeopathic doctor will be called after some time, because he will use the counter medicines of allopathic medicines, or what you call the conventional system of medicine. And once he has not been responded, means he don't want to go for laboratory investigations, and everybody will be afraid of the disease and cost of the medicine and cost of the investigations. So as a shortcut, they will come to homeopathic doctors, and homeopathic doctors do give treatment, and they have to be cautious. They have to take some of the steps without with their experience. One can diagnose the case. If that is needed be, he can refer the case for investigations. If not needed, he can give treatment. He can he will examine the patient physically, and if he satisfies entirely, he may try his medicine. He has to try keeping these danger signs in mind. and give treatment. If the treatment is found to be effective, see, without any expenses, with the 200, 300 rupees, the already he spent around 1000 rupees, and we have to give proper instructions and give prescription and get success. It is not wrong, but always keep in mind that there will be a critic behind us. There are people who are watching us, and we have to show them the art of homeopathy, which will be scientifically validated. And clinical evaluation, history, onset, duration, fever pattern, travel history, mosquito exposure, animal contact, drug history, vaccination, associated symptoms. See, examination. Everybody talks about the side effects of the homeopathic medicines. One has written one article that Rustax never keeps quiet. Rustax also produces side effects. And homeopathic medicines are not so sweet as they think. When they have side effects, that means there is efficacy also present. In the same fashion, the vaccination is having side effect, that is fever. And when vaccination fever is there, they never talk about the vaccination fever, and they never discuss, and they never accept that it is side effect of the vaccination, and they will support their system. But whenever if certain fever comes in liver, see, I am dealing a case of liver cancer, and there is absolutely no treatment is present. They are giving immunomodulations, immunoglobulins in Apollo Hospital. I have given the chelidonium minor, chelidonium majors. Now his jaundice values have come down. We know that cancer liver patient will die one day, but at the same time, the management of why the jaundice is coming down, now they are thinking he is getting back pain. That means the lymphoadenitis is coming, secondaries are coming in the kidneys. But at the same time, the jaundice levels are coming down. If he survives from 3 months to 6 months, what is wrong? They are also not giving any medicines, whether it is placebo or homeopathy. The survival of the patient for more days is important rather than the killing the patient, telling that there is no treatment. So at this juncture, they are also not telling that homeopathy is bogus. As previously being discussed on media about some doctor criticizing the liver and everything. And these hepatologists, Apollo hospitals are keeping quiet with my treatment because the patient is surviving. The jaundice levels came to 12.5 of micrograms from 35 to 12.5. So they are very happy. Patient is making his life and he may survive another 3 months. What is wrong in it? So one has to understand in India needs, one is anthropologically, we have to keep the patient alive. Socio-economically, we have to think it is the humanity that first covers. It is not the qualification or it is not the knowledge. It should not be unscientific. Whether it is scientific work, whether he is educated or uneducated, if he follows science, a driver is not has invented the bus or the engine of a tractor, but he can drive very well. The see, whoever drives the tractor is a driver. Now he will deliver the goods. Now he do not know what is the mechanism. He can't talk in English, but he can repair his own tractor. So in the same fashion, health technology also has been developed so much, and one has to understand where it has to be questioned, where it should not be questioned. See, there is the government has not provided the transportation to rural areas. One travels by tractor. What is wrong? He has to travel. Neither he provides the transportation, nor he allows any tractor person to bring the patient or bring the person on humanitarian grounds to other towns. So what we have to do? So in the same fashion, one has to agree that homeopathy can't give precise lightly without any proving, without carrying out the research. Double-blind randomized methodology only will tell that homeopathy is placebo effective, and homeopathy is lesser than placebo. Lesser than placebo doesn't mean not having efficacy. So this one must know as a scientist. Now we have to examine temperature plus blood pressure, respiratory rate, oxygen saturation, skin rash, lymph nodes, liver, spleen. This everybody knows. And routine complete blood picture, ESR, CRP, and specific blood culture, urine culture, dengue, NSI, malaria, depending upon the stage of the fever, the symptoms he is producing, rapid malaria antigen, typhoid test, chest X-ray, COVID PCR antigen, and liver function test, renal function test, for which he is suffering, and the acute fever, which has to be cured within 14 days. Most of the cases will come to homeopathic doctor from allopathic doctors. One homeopathic doctor always keep in mind. I will always question with one allopathic doctor. I will tell you one geographical situation of Pondicherry where I am situated. We have 8 medical colleges, allopathic medical colleges, producing every year 150 doctors. Two government colleges, 150 seats. The other 6 colleges are 600 doctors. Every year, two batches, and 600 into 600. There are 35,000 doctors registered from Pondicherry in Tamil Nadu Medical Board. And homeopathy is thriving. I am existing. With me, there are another 28 doctors who are practicing. There are 14 government doctors. Our all OPDs are located in government hospitals vicinity, and I am doing fantastic research. My patients are not general patients who do not know, who are uneducated, because the Pondicherry is one of the city in the India which has economically and medical wise highly developed. All the doctors are the patients. Nobody criticizes because they know the limitations of their system of medicine. How patients are dying, why patients are dying, where negligence has been done, where the medicines are not present, how to make the patient to survive. So when they came to know their limitations, they are dwelling on other systems of medicines and they are following integrated of systems of medicines. They themselves are keeping their health well with homeopathy, with Siddha, with Ayurveda, with massage, with Panchakarma Chikitsa. So they know how to utilize. Only ignorant person will criticize. If the ratio of the doctor and patient comes all over India 1 is to 120, all the allopathic doctors will be homeopathic patients. What I am doing, I am having a paradoxical situation. I have to read more and more and more and more, because if I know more than allopathic doctor, then only I can treat allopathic doctor as a patient. Most of them are having PG facility here. Everybody is a MD physician. Some surgeon will come. So, see, cellulitis. I cured a case and they have seen, they have gone pillar to post. They came and they will ask infertility in the same fashion some of the fevers do. So this is the attitude. And if anybody criticizes other system, he is absolutely ignorant person of his own system of medicine. So general management, supportive care, adequate hydration, oral hydration, nutrition, rest. Rest is most important. 50% of the acute fevers will come down by taking rest. And temperature monitoring is most important. We should not believe any patient if he says that he is having 1 degree temperature or 1 degree less temperature, 1 degree more temperature, 102 temperature. Don't believe any patient as far as temperature is concerned. Kindly keep thermometer and see the case, then case taking everything, you do normal procedures and treat. The homeopathic approach. Homeopathic emphasis on acute prescribing should be always parallel to appropriate medical assessment. See, homeopathic doctor will be highly intelligent because he has to take the crude medicine, then potentize, then he has to face the social criticism, then he has to diagnose the case, then he has to deliver the goods. And so he will be always a researcher. Remember, homeopathic treatment should not be delay diagnosis. If your diagnosis delay, there will be allopathic doctors who are criticizing you on media. Then if your treatment is delayed, they also will criticize. If you can't tell where your drug is working, that also stands for criticism. If the patient goes for complication, that also stands for criticism. See, a patient is having a legality to die only in government hospital or in a corporate hospital. A patient with serious illness, which case has been rejected by government hospitals, either in cancer or in rheumatoid arthritis or systematic lupus erythematosus or septic fevers or anthrax bacteria fever. And if he comes to homeopathic hospital, if he dies in government homeopathic doctors, it is as if homeopathic doctor killed the patient. But if he dies in Jipmer hospital with some of the complaints, whatever I told, it is none of their business, and he died because they tried their level best. Nobody thinks that a homeopathic doctor treat the case that is failed by allopathic doctors. See, this is the fun. This is the paradoxical state of the system of medicine and country people thinking. So when every treatment is over, therefore you kindly keep in your office the medical ethics report that patient has to give consent for the treatment, and because the case has been discharged from any corporate hospital or any super specialty hospital, that the no further treatment is available, then only you are taking up the treatment, and the consequences of the results are not in your hands. You are only giving the medicine to prolong his life, and you are not giving medicine that there is guarantee cure available. So if such mechanisms compulsorily comes to homeopathy, then everybody will understand a value of the homeopathic physician. This is happening with me in Pondicherry. Everybody knows now case has been discharged. What they will do? They will come on stretcher to a OPD. See, this is the trouble. This is the paradoxical state. But who will understand all these things? Only a scientist will understand. So individualization, totality of the symptoms, characteristic mental symptoms, because we know only these tools. We have not modified these tools. We have to come out of these tools. We have to create a nomenclature new, and we have to make this approach very easily to be followed and reproducible. What is characteristic mentality, constitution, individualization, general modalities, fever stages, and everything. Not only fever, in any case record, we have to see that once he takes the case record and it has to be reproduced, once he treat the case, that has to be reproduced by other doctors. That mechanism can be taken. It is only laborious hard work, but somehow there is no determination among the planners, among the scientists of the homeopathy, and among the planners of homeopathy, among the bureaucracy, and among the political leaders. It is only just because cases has been reverted, so unfortunate cases are coming to us. We are becoming lost. See what homeopathic doctor's duty is. See, we are in between hospital discharge and burial ground. In between, we will stand always there, and we will make this transition smoothly. So that is the specialty. The government has to think of this, how they are making patient to survive. So this, our planners, what I am telling, our there is some defect at the think tank, at the same time in our education and pattern of the education at the higher level and at the political level and at planning level. So, aconite nepal, see all the medicines that have been found to be effective from Hahnemann period to today period, today's time, even after research found to be aconite, belladonna. See, there are indications. There are everything that are only, see, indication is sudden onset after exposure to cold, dry wind, anxiety, fear of death, restlessness. Aconite, everybody knows fear of death. But how many patients will come to clinic and tell that there is fear of death? So we have to only see that there is anxiety and restlessness. Restless anxietiness is composed with high hypertension. Whether he is having hypertension, see nowadays you will receive the patients to your clinic with diabetes and hypertension and associated with acute disease. You don't receive any case directly that he got fever. Very rare. It is not that you don't receive, but the patients, we have no injury patient will come to us. See, no fracture patient will come to us. If he comes, we have medicines. In the same fashion, the half of the population of the India has converted as diabetes, and rest of half of the population is going to become pre-diabetic and hypertension. With such complications, our patient are coming to homeopathic hospitals and homeopathic clinics, and there he will have acute fever, and that acute fever you have to attend. So your knowledge should be more than allopathic doctor's knowledge. We have knowledge, we have dealing capacity, but we don't have any control over the persons who criticize, because it is not the question of the unity. We have not worked at some of the areas where that is provoking everybody to criticize whatever, because it is a democratic country, so anybody can talk anything. We cannot control them. So that is the procedure. We are also having some of the lacunas where our think tank, our people, they never sit across the table. What they want, they are not, they are confused. See, they will beat always around the bush. The fundamental research that is needed, that is not being given priority. The research that is, see how to cure a cancer case. See, that is very well. We are doing a memo of understanding. We know how to treat rheumatoid arthritis. We know how to cure a cancer liver case. We know how to treat a kidney failure patient. We know that how to delay the dialysis, we can delay dialysis for a year. See, every dialysis needs 1200 to 1500 rupees, and we are dealing dialysis of a patient for 1 year means we have saved every month two dialysis in a week, and four dialysis, two into four, into eight dialysis, 8 into 12, 98 dialysis means 1 lakh rupees we saved patients. So these all we have to come into data production should be there. Our people are not in a position to concentrate on fundamental things. Fundamental things means presence of the power of the medicine, presence and mechanism of action of the medicine. Whatever I did on mechanism of action of the medicine, our people are not in a position. They accept, they realize, they recognize, they tell that I have done lot of work. At the same time, they suspect that if credit goes to me, I will get Nobel Prize. So those stages have gone. These are the people thinking in India. That's why the science never came up and science never comes up. So some of these things is belladonna. The indications, sudden congestion. Sudden congestion means there is infection. See, if you understand the pathology, all these symptoms are dependent on pathology. The anxiety fear coming means there is hypertension. So Econite will work on the clogged arteries where the ischemic heart disease and ischemia that has produced the paralysis and hemiplegia of the right side, it will be controlled by Econite. Econite will have action on hypothalamus. Econite will produce fear of death because patient when he is getting convulsions, when he is getting mm, acute ischemic transischemial attacks, ATI, AIT, transischemial attacks, he knows then he will develop fear of death. He says that I am going to die, but Econite will save. There is one patient with me whom I am managing from last 3 years with trans-ischemial attacks. He will be for hypertension and allopathy. He will be for cholesterol and allopathy. He will go once in a year for MRI scan and the ischemic tendency has come down. Every neurologist and every diabetologist will appreciate me how you are managing trans-ischemic patients with homeopathic OPD and what is the medicine. And they prescribe Econite, they prescribe Tuja, they prescribe antimonium crudum for chronic bronchitis. They prescribe Carbovig, how it will work on venous thrombosis, and they prescribe for varicose veins, hemamylase. They sit in my OPD and learn. So these all are the pathological symptoms that are coming. There is no individual symptom. There is no mental symptom here. Our people also in education, they confuse us. See, high fever, dry skin, anxiety, fear of death, restless, hypertension, sudden onset, fever will be sudden onset. After exposure to cold, everybody thinks that cold will produce fever. It is not the cold that produces fever. The below 0 degree temperature will always protect bacteria and virus. If you drink below 0 degree product, if you go to any Delhi or anywhere, the hotel will have below 0 degree temperature storage mechanisms where the food will be stored, water will be stored, as well as bacteria, virus also will be stored. When we drink that, we will get fever. It is not because of the cold body is responding. It is the virus that is also alive with the food product that is also entering into our body. That is the thing that cold, dry wind. It is not the cold, dry wind that is causing. Cold never causes anything, but cold holds the virus and bacteria or life. And belladonna also, sudden congestion. There will be infection somewhere, some bacterial infection. Throbbing carotid, see, carotid artery will, because the belladonna atropa, it is one of the atropine product. Even today, see, there are I always tell, there are 4 to 5 medicines which I remember, and there are more medicines also, have not changed from the day of Dhanvantri. The Vedas have been written from there to today. That is, one is digitalis, digoxin. They cannot replace it. Second is opium for painkiller. In those days, opium, morphine, bhang, cannabis indica, cannabis sativa, and today up to the opioids. There is a special medicine opioids for schizophrenia to pain killing. Even pethidine will be given. Pethidine is a product of opium. And they never go to jungle, they never go to forest and collect opium. They will copy, already they copied Ayurveda, Siddha and Homeopathy. So they need not go anywhere. They will build the structure in the hospital that is known as medical chemistry, and he will bring that structure, and pethidine injection will be sold for 1500 rupees. A 1 gram of opium, if you go to any tribal, he will give opium. See, opium is banned, pethidine is not banned. This is fantastic, contradictory things. So these are the things. And other is digoxin. The third is belladonna, atrapa. Third is arnica and mercury, glycerinum. These medicines have not changed. Iron. These medicines have not changed. Calcarea, even today calcium will be given. Those days also calcium. See, it became a daily routine habit in Indian culture to chew the pan with calcium carbonate being rubbed because one has to protect their health. So these are some of the cultural these things, and that has been copied, and that became an allopathic medicine. And if they criticize homeopathy or anything, we have to ask their drug products, their roots. So belladonna atrapa, why I am talking all these things is, see, atropine. The atropine is will be given in acute heart diseases where angina pectoris comes, a local injection of atropine will be given in the intramuscular region to control angina pectoris as on today, and it is the very costliest the medicine. And the same belladonna will produce here carotid throbbings. See, carotid throbbings have been observed, but why carotid throbbing is not coming? Why it came? It could not be observed because the technique gadgets were not present. So we have to change our materia medica depending upon the research outcome. We have to see that it has to be reproduced. So the pathology of the fever, the symptom, the delirium will come in the fever. Naturally, when the temperature is high, patient will utter something because there will be congestion in fever, and the fever will produce some side effect. So he is getting infection. The infection will convert into sepsis, and sepsis may leads to something. So we have to keep always in our mind whether belladonna aconite, gelsemium, or the case may be referred when there will be dehydration, how to give fluids for him. So these all we have to keep in our mind. Then stage 2. What is stage 2 is heat stage. What is the first stage? The stage chill stage. After chill stage, this is heat stage. This is for homeopathy classification. Dryness. Why heat? Heat will produce when the temperature comes, the body fluids will be evaporated and the temperature comes down. Naturally, there will be great thirst. Thirst for large quantities of water at long intervals is Bryone's one observation. But how many patients will come and say that he is drinking lot of water when we take the case record? No, no patient will tell. And there is no time also. We have to understand it is one of the symptom that has been produced by the fever pathology, and is nothing to do with patient's individualization or to select the medicine. It is as simple as a thing. How is your thirst? He says, we need not give any importance for this because there was no other mechanism in those days. They have been copied. See, many people, even after research, they are afraid to remove such symptoms from their research outcome. When the pathways have been identified by me, what is the necessary of writing all the symptoms which have been? If I don't write, I can't exist among the homeopathic doctors. So I am forced to write in my slides. But these symptoms will not be proved in pathological proving when the pathways have been identified of these medicines. Then gelsemium, drowsiness, heavy eyelids. These all are fewer symptom, weakness, influenza-like symptoms. See, he write influenza-like. Influenza has been identified after death of Hahnemann. And this person has introduced. Has he tested? Yes, maybe, may not be. So when you go to therapeutics, you will find influenza, you will find typhoid, and all these diseases have been identified after death of sixth edition of Hahnemann and Materia Medica Pura. So these are all the things we have to keep in mind when we are going for latest modern diagnosis. We are giving therapeutics. We have to change accordingly as per the therapeutics. When we added some therapeutics and we are writing some medicines, then we have to improve our research knowledge too. So we cannot write because I am an experienced doctor. Whatever I say, it become a law. No, I am a scientist. I have done proving, so it becomes a law. So see, we are even now in our scientific committee, there are people. Our homeopathy never suits to your research. No, it suits. People do not know how to make it, and nobody takers for homeopathy. Nobody wants to do research in homeopathy. We have to feed them, and our people also confused what is the job work that has to be taken. And politicians, they know that whether it is scientific or unscientific, kindly cure my migraine. So they come like that. This is the status of homeopathy. So Baptisia, septic stages. He has written already septic. What is septic? Septic was not present. They used to say he's a zygomatic fever. Zygomatic fever means the oldest language of the medicine. See, zygomatic fever, that is septic status. Offensive breath, toxic appearance, delirium, these all are the status of the acute fever. Then stages 3, restless body aches when a person is having, see there are two differences where see a restless patient feels better by movement. Anybody who is having fear, if there is some mild massage is being done, he will feel some of the patients will respond. At the same time, some of the patients will have acute bony pain like bryonia and it will convert into upatorium perfoliatum, where if he touch the bones, he will have pains. That means he is going for viral complicated fever. We have to diagnose, then we have to treat that case. Then China officinalis, weakness after fever, and the Syncona is a very good medicine in allopathy. Risocin injections will be given for Plasmodium vivax and Plasmodium falciparum. And at the same time, the Syncona bark has given life or given or the origin of the homeopathy is through Syncona bark, you know very well. And this Syncona bark will not be effective against malaria in homeopathic potency, but in low potencies, if you give in 3x, 6x, and if you give in 3C2, it will be highly effective. And if you use Telusi, it will be highly effective. So periodic fever will come. The pattern, what is common patterns of the fever? Continuous fever, thyroid. Intermittent fever, malaria. Remittent fever, septicemia. Relapsing fever, Borrelia infection that comes in South Africa. Biphasic fever, this is dengue. So dengue is very common where it will produce arthralgia, the small joint pains with swelling, and Upatorium perfoliatum is the drug of the choice, like paracetamol is drug of the choice. In the same fashion, and that drug you have to go in low potency and it can be reproducible. Any graduate can give Upatorium for perfoliatum for dengue fever. And the platelet counts will come down. Kindly, if the platelet counts, if the complications are coming down, go for calcarea, carb calcarea, arsenic, calcarea fluor. It will increase the platelets. So many cases, see platelets until and unless it never comes down to below 80,000, it never produces any complication. Gradually, the platelets that will be produced, because the allopathic, usually patient will come from allopathic hospitals where they give so much of risocin, so much of antibiotics, then antiviral things which will suppress the bone marrow. So naturally the platelets will come down. The platelets regeneration will take 15 days. The patient, if he comes after 14 days, it becomes chronic fever. If he is coming below before 14 days, dengue fever, many people will drink that Ayurveda juice also. So we have various medicines that will increase the platelet counts. We need not worry at all. Just give Upatorium perfoliatum, it is dengue fever. When the patient general physical body with vitamins and vitamin C improves, his platelet counts will be normal. But the allopathic doctors threatening and patients facilities, comforts, and money is making them to reproduce and fear complex. At the same time, nobody wants to take risk, but they want to take risk of becoming a chronic patient and become serious with their disease condition. They never take any prevention, but at the same time, after the disease comes, they are ready to spend. A patient will be always a patient. So we have to see that psychology, that aspect of the society also. So continuous fever is typhoid, intermittent fever is malaria, remittance fever is septicemia, relapsing Borrelia infection, and biphasic fever is dengue. So what monitoring during prevention, temperature, pulse, blood pressure, respiratory, hand hygiene, safe drinking water, vaccination, mosquito control, nutrition, adequate sleep, early medical consultation. A patient has to do nutrition adequate, doctor has to advise. Vaccination, mosquito control, doctor has to advise mosquito control. Vaccination is not at all needed once a patient comes. Influenza is coming, measles also coming. Vaccination was taken. How many people are we telling that measles vaccination is not effective in this patient because he has taken measles at the age of 0? Are we telling that a tuberculosis patient is getting tuberculosis though he has taken anti-tube BCG vaccine at the age of 0? Why the secondary tuberculosis is coming in the treatment of the patients? The doctor who criticizes, we have to make him to sit in front of me and we have to question is, sir, why are you getting hepatitis B? You have taken vaccine. He can't answer. Has he proved that after taking the vaccine, this particular person never gets? No, its efficacy is only 60%. The 40% of the people are going to get hepatitis B, hepatitis C. He is an hepatologist, he criticized. Can he give the assurance that he has taken hepatitis B and nobody in the world will get the hepatitis B? No, it is not possible. So when he is getting the hepatitis B and cases are coming, can we file a suit against vaccination? That vaccination has been taken. The doctor has not taken responsibility. No, it is not like that. In the same fashion, he cannot argue that homeopathy is placebo without doing experimentation. That is research. So hand hygiene, safe drinking water. So we have to monitor the urine output and everything. We have another important part here to discuss is what is the efficacy. I have another 5 minutes of the time I will discuss. Current evidence of homeopathy. This when we prepare a paper, we will prepare like this. Research on homeopathy for active febrile illness has been produced mixed results. What are the mixed results? Homeopathy will be very effective as an intermittent remedy, and 50% of the medicines have produced 50% of the results. If you take 100 cases of fever, 50 cases we can cure. Acute fevers, I am not talking about chronic fever, fever that comes because of hepatic degeneration, fever that comes because of malignancy, fever of the tuberculosis, or fever of systematic lupus erythematosus. I am talking about acute fevers. Some clinical studies have reported improvement in symptoms, duration, or patient-reported outcomes. But systematic reviews, every research will have a limitation. We always write in every research paper will have that the studies have to be conducted on large samples, large samples, large samples. Even the antibiotic, even the paracetamol also needs large samples. You will find daily one paper on aspirin. It is an endless job because where to put full stop, they do not know. Because aspirin produces side effect, aspirin also make the blood thin, and aspirin also can be withdrawn before surgery. In hemophilia patient, aspirin is contraindication. In hemophilia heart patient, aspirin is being given and bleeding is not coming down. So which is right study, which is wrong study, what they made, which is applicable to which patient cannot be done the studies. That particular individualization and understanding is only possible with homeopathic doctor, not with allopathic doctor or with scientist. See, hemophilia patient, he will have bleeding, internal bleeding, and he should not be given aspirin. As a child to 35, 40 years, we are not giving. But hemophilia patient of 60 years developed diabetes, developed hypertension, developed heart uh, clogging also. There is also a block in the heart blood vessels. So they are giving aspirin. But aspirin at this time is not producing any reverse effect on hemophilia, and the bleeding time has not increased. Those studies that have been made, and he has undergone stent surgery. During the stent surgery, anesthesia we also given, aspirin also given. Aspirin, nothing has happened. See, they do not know that studies were endless. So in the same fashion, every research paper will have systematic conclude that evidence is limited by small samples, naturally small sample. What is the sample size? The highest sample size is total world. So at present, there is no high certainly evidence that homeopathic medicines can replace established. This is fact. No system will replace other system. Is allopathic is replacing Ayurveda homeopathy? No. Is homeopathic patient, the hospitals are not getting patients? Yes. Is homeopathic doctor not treating the case? Yes. Why the practice is not up to the mark? It is the defect of the homeopathic think tank where they never prepared their disciples, where they never prepared the old institutional, see Father Muller or what you call in Kerala devoted persons. See, most of the persons, and in Andhra, if you go to Guru Raj or somebody, such a diverse, some Mukherjee, Banerjee, and Diwan Jayachan. So, such people have gone who have devoted their life where the science was not present. Nowadays, the medical education became think tank. They are not thinking of, see, they are taking the AI help for proving that homeopathy is scientific. So even that AI is also helping. How to take AI help that homeopathy is scientific also do not know. Think tank is our planners, our people are at a higher state are very weak. And homeopathy were used should be considered as adjuvant. See, it also acts as excellent adjuvant medicine. We can prevent sepsis in a patient of cellulitis. We can prevent stroke in patient of, we can prevent the fever in a patient of stroke. We can prevent acute attacks of the fever in chronic patient. So these all will be done with homeopathy. And this is the current evidence for homeopathy. And evidence is present without any discrepancy, without any fear. You kindly go for your prescription. You understand the acute fever case pathologically very well, and you can reproduce with all the medicines. What are the medicines? I will tell you. The summary of the frequency of medicines for fever is Upatorium perfoliatum, Gelsemium, Bryonia alba, Arsenic album, Rustax, China, Natrum mur, Belladonna, Econite, Influenginum. See where Natrum mur works, there there is another medicine, that is ferrum fas, is not necessary. The natrum mur will work anemia produced by malarial temperature, where there will be weakness, and the malarial consequences are anti-malarial drug research in that will produce, that will be cured by natrum mur. It is an evidence-based medicine. You can reproduce, you can repeat it. All you have to select the medicine according to the stage of the diagnosis. You are the master in your clinic to diagnose the case, and you are the master to treat the case. There is no confusion. Even in allopathy, there are so many medicines for fever. They are not called as anti-temperature medicines. They are called NSAIDs, non-steroid anti-inflammatory drugs. NSAIDs. One is paracetamol, second is acetic acid, third is Novalgine. So they give any medicine, either injection form. So that's all. If it is not working, they will increase the dose. Here
Yes,
also,
sir.
you have,
Sir, our
yes,
time is already over.
over. Right.
We
Now,
can we
these
can
are
have
some of
another
the,
we can have another session on this because this is
definitely on chronic cases, sir. You
yes,
kindly
sir.
go for this. I added these slides to you. Crude action. This is mechanism of the action that has been found. You have to see this last slide. Belladonna. These all mechanisms are proved on animals. Two drugs which have been reproduced in vitro in vivo studies is Econite and Rustax, and they are producing intraleukin, controlling the intraleukins that will produce pro-inflammatory disorder in the body, and that have been proved on human beings. You can play with games with Econite like any other paracetamol. You can reproduce, you can, this is immunological pathway of the homeopathic medicines: acute infection, innate immune activity, cytokine release, fever and inflammation, individualized homeopathic remedy, hypothesized modulation, host response. Anything will come, and clinical recovery. So this is by this is the conclusion. Homeopathy approaches fever to individualized. See, this is, thank you very much. I have taken much time. Now, sir, you can go for, if discussion or anything, something is there, or if there is no time, you have to excuse me.
Yes,
9:30.
sir. Yes, sir. It was really an excellent session, and you really we got some different concept of treatment in viral fevers, and that's what we got from the presentation. And you have shown in a different way also that because of the kind of different research work needed in that way, and how what kind of research going on in that way also, you know. Yes, we need to ask our authority to give quick solution to outbreak of such diseases, and finding a preventive drug as far as possible, as early as possible also. So with that, I am thanking you on behalf of the members here as well as the participants, and already our time is over. That's the reason why there is no time for discussion. We can have another session. Uh,
Another session, sir, we can talk about the preventive medicine in homeopathy for fevers. We deal with chronic fevers also, sir.
yes, sir. Yes, sir. Yes, sir. So
We will
that
take another
at
one.
that
Yes,
time we can dedicate at
yes,
least
sir.
10 minutes. Sir, please dedicate 10 minutes for discussion because everybody want to have some question and want to have discussion also.
Yes, sir. No, next time I will take only 45 minutes of the, I will talk only for 45 minutes, sir. Definitely, I will see that I will limit my slides, and I never enter into. Manoj sir, namaskar. Ram Pravesh sir, namaskar.
Okay. Thank you. Thank you,
Shaila
sir.
madam, namaskar.
Thank you
Many
all.
other people are there.
And tomorrow we will have a session
Okay.
at the same time. So hope all of you will join. Same time tomorrow. The faculty will be Dr. Misri. Okay. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam
Thank
session.
you. Mistry is a surgeon, sir. He is a allopathic doctor, speaks about homeopathy.
No,
Wonderful doctor.
sir. This is another homeopathic
Another Mistry. Okay, okay.
lady doctor.
Yes, yeah. Thank you. Thank you, sir.